Hello and welcome back to Momentum Matters, your easy way to stay connected with what's happening across medicine's clinical care and regulatory updates in the UK. Each episode, we explore the topic shaping practice in the care settings today, from medication-related incidents to epilepsy, diabetes, allergy and anaphylaxis and everything in between. Join us as we discuss the developments, insights and real-world considerations that matter to care managers. I'm TJ, and usually I'm right here in the thick of the conversation, but this month I handed over the mic because honestly, some conversations are best left to the people living them every day. On the 12th of May, it was International Nurses Day, and we thought what better way to celebrate than have three of our very own clinical nurse trainers on the episode. Hollie, Liz and Lizzie. Between them, they've got decades of nursing across paediatric, complex needs, high dependency, wound care, tissue viability, elderly care, and more. And now they bring all of that into the training room for us at Momentum People. I could tell you how much they love what they do, but this episode does it so much better than I ever could. Whether you're a care manager, a team leader, a nurse yourself, or just someone who wants to hear what it sounds like when people are truly passionate about their work, this is one for you. Sit back, enjoy, and I'll see you at the other end.
So welcome to this podcast for Momentum Matters. This month we have celebrated International Nurses Day. So we thought that we would get us three nurse clinical trainers on to a little podcast to have a little chat about just nursing in general, why we're nurses, how we came about being nurses, and just sort of a general chit chat really.
Yeah.
Hi everyone, I'm Hollie. I am a clinical trainer for Momentum People. I've been a nurse for about 16 years now. My background is in working with children with with complex health needs.
Hello, I'm Lizzie. I'm an associate clinical trainer for Momentum People, and I worked in the NHS up until last November. I've been qualified since 2018, so 9 years-ish, coming up to 9 years, and my background is sort of all over the place, really. I've done orthopedics, complex wound care, dermatology, and now I'm focusing on my training role.
Hi, I'm Liz. I've been training for the last 8 years for Momentum People. I'm a paediatric nurse by background. I worked in the NHS until 2022. It's been a 45-year career. I've done lots of different specialties within paediatrics, but now I am very passionate about my training role with Momentum People.
Wonderful. Thanks, everyone. I don't know if we all want to start with why we all became nurses. Liz, do you want to go first?
So I'm the oldest, aren't I? So I'm quite old, but I'm not saying how old I am, but I'm quite old. But I always wanted to be a nurse. So when I was about 3, I remember telling my mum that I wanted to be a baby nurse. So I used to love babies and baby dolls and stuff like that. And I carried that on actually through all of my childhood. It never went away. I always wanted to be a baby nurse. So it was just sort of organically, I just went into it wanting to be a children's nurse. I said baby nurse, but obviously children's nursing. And my first ward, funnily enough, was baby ward. So that was like almost manifested from the age of 3 to be a baby nurse on a baby ward, which was fabulous. So yeah, that's what took me into it.
That's amazing. So you wanted to be a nurse from when you were like 3 years old. I feel like it is sometimes you do. Young children want to be either nurses or teachers, don't they?
Yeah, they do. My mum always wanted to be a nurse, but that wasn't really, at that time, it wasn't really a viable thing for her to be able to do. So I don't know if that's where it came from. Maybe she talked to me about it. I don't remember. But yeah, I definitely remember always wanting to be a nurse, as long as I can remember.
How about you, Lizzie? Did you always want to be a nurse as well?
No, so actually, I think it's quite interesting because I was kind of the opposite, really. So I don't think I ever really had a very strong sense of what I necessarily wanted to do. But I was always very into art and drawing and painting and that kind of thing. So originally, when I left school, I did an art degree, which tends to not be useful for very much unless you're going to be an art teacher. But then I was thinking about going into art therapy. So using your art as a means to get people to communicate essentially and to kind of, I suppose, depending on who you're working with, kind of help them to process things that have happened to them in a way, if they haven't got the words potentially to do that for themselves. So for that, I needed some experience with people with problems with communication. So I started working in a elderly care setting, residential and nursing care. And I don't think I'd ever really thought about what nurses do day to day. I just kind of knew that, if you go to a hospital or a doctor's surgery, you might see a doctor or you might see a nurse. But working alongside them, it sort of clicked in my brain, and I sort of thought, interesting. This is something that I can see myself doing. And it went from there, really. So I did a nursing course from there. And since then, I've kind of worked in a few different settings. But my main thing, as you both know, is wound care and tissue viability. I will always jump at the chance to help somebody to try and heal a complicated wound. And that's kind of where my career's taken me to this point. And now I'm working with you guys in training. So, yeah. How about you, Holly?
So I always wanted to be a special needs teacher. So a teacher in a special needs school. So when I finished school, I didn't go off and do my degree because I'd had enough of education by then. So I went and worked with adults with autism and came across some very challenging adults, shall we say. Realised that really wasn't what I wanted to do. And then went and did a social work and nursing dual degree. I thought I was going to go be a social worker. And then all my placements were with children with complex health needs. And I just fell in love. And I always say to people, once you work with children with complex health needs, you'll never go back.
100%. I have to 100% jump on that, because all of my nursing career was in a children's hospital, in all different areas in a children's hospital. So I started off on that baby ward, went round in my training doing all the different wards. I only had an insight for 6 months into adults and didn't like them. Like children, I find children quite refreshing to care for. And I worked in a high dependency unit for 15 years and saw like the worst of the worst, if you like, when they're really, really poorly. I ended up through lots of different hoops that I was offered a job in a children's complex health needs team, working in the community in their own homes. And I thought I could really give something to that. I wasn't sure years ago that I could nurse children with complex health needs. In fact, I'll hold my hands up and say I avoided them. I think I didn't understand them. I had an experience as a young nurse on that baby ward with a child that had complex needs that kind of put me off a little bit. So I avoided them and didn't work with them properly for years. And then when I was offered this role, I'd actually taken myself into a short breaks as an agency nurse, because I realised that was something that, as a children's nurse, I should be a bit more all-rounded. And I fell in love with them when I went to that short break. So when I was offered the job in the complex health needs team, it was the best thing that ever happened to me. It was the highlight of my nursing career. You literally, once you start caring, like you said, Holly, once you start caring for kids with complex health needs and see how strong they are and what they live with day to day and still smile at you, you can't help but be in love. You can't help it, can you?
It's that resilience, isn't it?
Yeah.
Yeah.
How amazing are they? You think when you're having a bad day
with them and
yeah,
and their families and
yeah. When you're having a bad day, you look at one of those kids that's got all of those things going on for them and all those needs, and they're still smiling at you, it kind of gives you a kick up the backside and says, actually, you're not having a bad day. He's still smiling. Look what he's got to deal with. And I think that's where the love comes from. Yeah.
Definitely. Lizzie, if you ever work with children with complex needs, or is your niche definitely in adults?
I'm definitely an adult's nurse. I've always said it's quite terrifying how quickly children can get very poorly very quickly. Normally in an adult, you get a bit of warning. You can kind of tell they're not quite right, or something about their observation starts to change, and you kind of get a bit of a sense that something's about to go wrong. Whereas with children, it feels a lot more like 1 minute they're absolutely fine, and the next minute you're resuscitating them, which is not the most relaxing experience in my opinion. But anyway, but yeah, I think what really sort of I suppose it's a similar thing in that I really enjoy working with older adults with cognitive impairment. So whether that be conditions like Parkinson's or multiple sclerosis or things like that, or whether it's dementia, being in their world, even for a little while. I mean, sometimes it's a very weird and wonderful place. Sometimes it's quite a scary place, but actually a lot of the time there's a lot of joy there as well. And even if they are confused, you can kind of do a lot to help them feel comfortable in their environment and help them to feel connected to other people. And that's really rewarding in itself, actually. And you build those relationships with that person, but you also get to know their family. And sometimes I think you almost know, in some cases, you know them better than their own family, because you see them day in, day out. You see them at all times of the day, and you see them at their worst and at their best. And you can respond to that person very individualistically and very sort of holistically, if you like. And that's a real privilege, actually. And you can sort of sit with them through all those experiences that they have, but you can also often, sort of the eventual outcome is that you are helping them with their palliative care, you're helping them with their end of life care. And actually, although that sounds like something that might be quite a sad time, actually you can make it a really positive experience for people, and you can support their families through it. And I think people remember whether or not things like that have been a positive experience, and you can make a real difference with that. So to me, that's kind of what I would see nursing as. I guess you're kind of with them through every step of the way, which I guess is similar to what you're doing with children, really. They're growing and they're developing. And
when you were just saying that, I honestly thought that was just mirrors what we were doing, what Hollie and I were doing, because just at the other end of the end of life. I was more the beginning of life, and yours at the end. But actually, both of those scenarios is very similar, isn't it? Because everything that we do with the children, some of them are life limited, so some of them are going to die, and you do become part of that, making a plan and making them comfortable and giving them the dignified and they're going to have. So I think in a way we are very similar. It's just at the other end of the scale.
Yeah, absolutely.
It's lovely to hear you say that, how passionate you are about that. It's lovely.
I'm thinking exactly the same as well.
Part of me misses a little bit so when I was a care assistant in that circumstance, I think the role is slightly different. Obviously, as a nurse, you've got kind of more pressures on you, I guess, in terms of what you're trying to cover in that shift period and what you've got to get through. Don't get me wrong, carers are incredibly pressured as well, but I think just those little moments that you get when you're helping someone to get dressed in the morning, or you're helping somebody to put their makeup on. I always used to have a fab time doing hair and makeup if I got the opportunity to do that. That's a real bonding experience, and a real, even somebody who's got dementia, for example, having your hair done is almost a universally enjoyable experience, isn't it? Nobody can not enjoy having their hair done, no matter who they think is doing it. So I do miss aspects of that you don't really get the opportunity to do necessarily when you're juggling medications and care plans and sort of escalating concerns and that kind of thing. I think you do lose a little bit of that when you are qualified as a nurse sometimes, which is a shame, I think.
Yeah, I think you're right about that, actually. I think when I started nursing, there were 2 levels. So there was just the staff nurse and there was the enrolled nurse. And I trained as an enrolled nurse for that very reason that you're just talking about, Lizzie. It was a bedside nurse. That's what it was considered to be. The staff nurses were the management side, and the enrolled nurses were the bedside nurses that did all of those things that you're talking about. And that's what I wanted to do. As time moved on and nursing moved on, all of the enrolled nurses were I'll say pressured, because it was pressured into doing the staff nurse conversion so that everybody was the same, which I felt was a little sad. The funny thing is that now they've replaced enrolled nurses, haven't they, with different levels of NVQ carers. So actually it's gone full circle. They took away the enrolled nurses and made them all staff nurses. And now the carers are now doing different levels of NVQ for doing different levels of nursing with patients. So then it's great for them. If they didn't have the qualifications to do nurse training, they actually can do what I did initially. I didn't have the qualifications to do the staff nurse. I didn't have the GCSEs for that, but it wasn't what I wanted to do anyway. So now you can see that people are having that opportunity. People that would be the most amazing nurses are nurses now, because they're all nurses, carers or not. They're all nurses. They're just non-registered nurses. That's all. What about you, Hollie? Have you got any stories?
Oh, all sorts of stories. So I suppose for me, like you were saying earlier, Lizzie, children can go off quite quickly, can't they? They just all of a sudden they can just kind of turn blue or something like that. I think one of the things that I really remember is in my first couple of years of nursing is I was nursing someone, and I had a student nurse with me, which is one of my favourite things ever. I love having student nurses. I love the fact that we have these really complex children and these really niche skills that we need to learn, and I just love passing that information and those skills on to other people. I'll never forget one day, very complex child, shall we say, and we've turned him over to her and get dressed and things like that. When we turned him back, he'd gone completely blue. I laugh about it now, but it wasn't scary. It wasn't funny at the time. And this poor nurse, the student nurse that was with me, looked absolutely terrified. But I think because I've been nursing in complex needs for, you know, a year or two at the time, I knew exactly what to do, and I just kind of did it, talked her through what I was doing while I was doing it, and then debriefed with her at the end. And she just said, Hollie, you just did it. You just knew what to do and you just did it. And I said, yeah, but that's what training's all about. That's what our skills are. That's why we do what we do. And that's why you're here, so that I can pass that knowledge and those skills on to you as well. To the next generation, you know, to because we need more people with these skills, really.
It's really great to hear you say that, because I actually had a very, very similar experience myself with we called them family support workers in my old team, and with somebody who'd just started, and it was very much the same thing. The child collapsed, if you like, and bless her, she looked like a deer caught in the headlights. She was terrified. But like you said, it gave me an opportunity to pass on like knowledge and skills to her, and explain to her that yes, this was very, very frightening. However, we're training you to manage it the same as I just managed it. So yeah, it is. I think that's one thing we're all passionate about, as in passing on our skills and knowledge to the next generation.
Why we've all become trainers. We're all now clinical trainers, aren't we?
I think so, maybe. I mean, I find myself telling people that I'm training all the time that I want to keep you safe in the community, because people don't realise how cushioned you are in a hospital, I think. You know, you have that whole NHS thing behind you. You have doctors and nurses and resource teams and all sorts behind you, don't you, when you're in a hospital? But when you go into a community environment, you don't have that. It's not there. There's no doctor. You can't press a crash button or anything like, you know, you can't do anything like that. You literally have to have the skills and knowledge to manage those situations. So for me, that's a massive part of our training role, our nurse training role, is to make sure that people and children, and in your case, Lizzie, adults, are safe in the community. That's a big thing for me.
Yeah. I mean,
definitely.
If you think about it too hard, it is scary, isn't it? Because there's a lot of responsibility on your shoulders, because you haven't got that backup necessarily of somebody who you can just shout for, that will will have all the answers, or at least be more experienced or whatever than you might be. But actually, I think it can be quite empowering as well, because it means that you're in a position of trust, aren't you? You are trusted to make those decisions, and people have faith that you are capable of making those decisions, and that's quite an empowering thing, I think. And with good quality training, then that's absolutely possible. You know, we know we know that people who work day in, day out with a person will know them better than any sort of, no matter how qualified they are. They will know the warning signs. They will know what that person is normally like, and actually their perspective is really useful in understanding that person's better or worse than they were.
Absolutely. They're the ones on the shop floor, aren't they? They're the ones that actually really know that person inside out, backwards, and the other way around. Yeah, definitely.
Yeah, definitely.
It's invaluable, isn't it? I mean, we can teach the clinical skills, we can teach them what we're doing, how we're doing it, why we're doing it, which I think is really, really important, isn't it? I think people understand why they're doing things. That really embeds it, doesn't it? That learning.
Yes.
But I think we have to understand that actually people know the people that they're working with much better than we do. You know, potentially we've never met the people that they're working with.
Yeah, exactly. You definitely have the experts there. When you go in there, they are the experts. You know the nursing skills. You can train them on those nursing skills, but they are the experts in that child or that adult that they're caring for. They know them so well. And I find that in training really useful, because we kind of educate each other, don't we, while we're training them? Yeah. They have their stories.
And I don't know about you, but I always say, go to the community nurses. If you're worried about anything, go to the community nurses, because they're the experts in these children. A lot of parents will go to the GP and they'll bring back Fusidin cream. Now, I love Fusidin cream for what its purpose is, what it's used for. But you know, they'll get it for different things, and you kind of think, well, why have you been given Fusidin? That's not going to work. So I always encourage people, go to the community nurses. Don't go to the GPs, because you know the community nurses, it's their bread and butter, isn't it? It's what they do for a living. It's they're the experienced people.
GPs are fabulous. They have a massive workload. Absolutely. They know a little bit about everything, don't they? But the specialist parts of medical care they only have a little insight into. So again, I've found some GPs have tapped into my knowledge and said, look, this child, what do you think? And I think that's really nice. It's a good collaboration rather than, oh, it's a GP, he's a doctor, he knows better than I do. It's nice when a doctor will, a GP or a doctor will actually ask you for your opinion, or actually ask the parent or the family of that person, what do you think? Because it's a team thing, isn't it? It's a team around the person. It's not just one person goes to the GP anymore like it used to be back in the day. It's lots of people with lots of knowledge and skills.
Yeah,
exactly.
Definitely. I think I really enjoy that about the training role, actually. I think good training is kind of a two-way street, isn't it? Because it's a conversation. It's not just I'm here to impart my knowledge and you'll all sit through it and, take lots of notes and then go away again and that will be it. It's much more, the more about lived experience it is, the more about bringing your own experience and your own knowledge to a situation, the better, actually. So I delivered a session fairly recently where somebody in the room had got experience of looking after a family member with type 1 diabetes. It was a diabetes care session. And actually that's invaluable because you think, great, there's somebody in the room with actual lived experience of any scenario that I'm going to come up, any imagined scenario that I can come up with is not going to be as effective and real life than one that has actually happened. So it's great when somebody comes to the room with that much experience because you can really dig into some of that and sort of see how things have changed over time as well. If they've lived with that person for 20 years, they've seen all these new technologies come on board and how that positively impacts them or how that negatively impacts them. It could be either way, but
I had a group that I was training recently who had a child that died of epilepsy, actually collapsed at their short breaks and passed away in hospital. That experience, we talk about death in epilepsy when we do training, don't we? We talk about it and we try to explain it and explain how not to happen. But to actually talk to carers that actually experienced that with a child under their care was eye-opening. I think that, like, the emotions and everything go with it. As trainers, we can say what we know about it, but if you haven't experienced it, you can't quite put that emotion behind it. When they were talking about it, it was a long time ago. It was about 11 years ago. So time has gone on. It's not as raw for them, but they could actually explain it from the coalface, if you like. This happened to us. We were there. We felt this. This is what happened in our place of work. This child collapsed. It was a previously well child that actually his epilepsy was under control. So it was a shock. It was a massive shock to them. So I felt kind of humbled listening to them. I might be a nurse trainer with years of experience, but actually that experience that they happily shared with myself, obviously the group already knew, for me was something that I will take forward in my training and share with others with their permission as to what actually happened and how it actually felt for them, because we teach these people all the time. And you can talk about it and you can put some slides up and say this famous person or that famous person died, but to actually have an insight into the emotions and everything that happens around that was humbling. It really was. And for me as a trainer, I was so grateful to them for sharing that with me. I think when people do share those kind of situations and scenarios, it makes us better trainers because we take forward and learn from them. So it's not just us training them as nurse trainers, it's actually them training us as well.
Yeah, definitely. And I think when you're giving those examples to people, you're giving a real life experience, aren't you? You're making things real. So, you can talk around things for, all day, can't you? But if you're giving real examples of things that have really happened, that's what sticks, isn't it?
Yeah. And I mean, that is a very sort of a downer type experience to share, but a very important one. And it didn't, the whole feeling of the training didn't stay down. It was almost like they had done the very best for that child. And this was how they felt about it now. Had it been last week, it probably would have been a bit too raw to talk about, but it was definitely a massive learning experience for them. And it will be for me as well going forward, I think. So that's the other part of training, isn't it? They train you.
Yeah, exactly. And those experiences are invaluable, aren't they? You don't get that sort of that feedback when you do training online, do you?
No, you don't. I don't think they would have shared that if had it been online, because I've trained them before and they've never shared that. So I trained them twice before,
Yeah.
and they'd never come up. So I think the fact that we were in the room with them did make that actually come up, and it was a discussion that I could react to appropriately. I would have felt a little distanced if it had come up online, I think. But see, sometimes we have to train online, don't we? So but face to face is my dream to train.
I suppose that's another thing, isn't it, that nurses do almost. I think because we're very close to the person that we're looking after, aren't we? We get physically close because we're helping them to do day-to-day things, but also we become. There's a professional distance, obviously, but there's a lot of emotion there that you experience and that you share in with the person and their family in a lot of cases, or in the training situation with the people that you're training. And you build that trust, don't you? You build that relationship with them, that they feel that they can talk to you about these things. And actually, we nurses often have to we're juggling a lot because we've got lots of skills. We can teach all those skills, like Hollie said earlier, we can teach all the clinical skills, but actually that relationship building and that
is key.
Level of trust that you develop is kind of, you can't really teach that, I don't think.
No,
I think you're that kind of person, or you're not, that can sort of sit with all those emotions but continue to do a professional job almost.
Yeah, absolutely. I remember a long time ago when I was a very young nurse on that baby ward, I nursed a child that at that point had a life-limiting condition. Nowadays it wouldn't really, but back then it did. And he was a child that they'd tried for years and years and years. And they had this little boy, and he had this condition, and he did pass away. And on the day he passed away, I'd got so close to this child because I'd been nursing him. I'd been nursing him every day that I was at work, caring for him, getting to know his parents. On the day that he died, I cried. As a nurse, I cried. I couldn't help it. I wasn't sobbing, but I had tears running down my face when he died. And a senior member of staff hauled me out of the room and told me off for crying because it was unprofessional. And I think nowadays that would never happen. You would be considered to be, I'd nursed that child. I was sad that he died. His parents were glad that I was sad that he died. Do you know what I mean? That I wasn't just a hard person that wasn't showing any emotion. But I think you see the changes in nursing over the years. That would not happen now. It'd be, somebody would probably tap me on the shoulder and say, do you want to go and have a break or something? But I wouldn't be told off for having tears of sadness that two parents had lost their beloved child. I wouldn't. So things have changed. Things have definitely moved on. That would not happen now. You would be treated with respect and kindness if you had a few tears. Whereas back then it was a bad experience for me. It was a horrible thing to think that somebody would think it was a bad thing for me to be sad that a child died. So things have definitely moved on now. Hopefully you guys haven't experienced anything like that. No. See, that takes you back to sort of, the years that back in the years of like 40 odd years of nursing. Things have changed a lot. And things have moved on. And the one thing that I did notice, I noticed that changeover actually when I'd been nursing about 10 years. There was a sister on one of the wards that was so ridiculously qualified. She had so many degrees and qualifications and whatever, but she was an absolutely rubbish nurse. She just had no idea how to do bedside nursing or to nurse a child. She was she could run a ward and she could run staff and do all that, but she couldn't nurse. And I think they went through a period of time where it was all about the education, not the bedside nursing, whereas now it's both. So they went from bedside nursing to just management, and then turning out a load of nurses that couldn't actually nurse, to then moving it forward again to being both. And that's where we are now, isn't it? Management and actual on the shop floor working with patients. So it's over 40 odd years. That's how it's changed. And you won't have seen that because you're young girls.
Changed. Yeah. I'm not going to say I'm particularly young, but anyway, it's all relative, isn't it? Do you think the job's got harder over time, or do you think it's do you think it's, and I'm not going to say easier, I don't think anything is ever easy in healthcare. I mean, obviously things are a lot more complex, aren't they? There's a lot more we can do for people. People live a lot longer with much more complicated conditions. But do you think nursing a better profession than it was, or do you think it's more difficult than it was? Or
I don't think better would be the word, but I think it's different. You can always say, oh, back in the day, or in my day, you hear elderly people saying that in my day we did this, that and the other. When I started, there was definitely the levels, the two levels. There was the staff nurse and the enrolled nurse, the people on the shop floor. And you knew exactly what you were doing. You'd come into work, you'd be allocated your patients, and that's what you did. It was all about the patient if you weren't a staff nurse. So for me, all I did was care for babies, which was my dream. That's what I wanted to do. I didn't want to be managing the ward or anything. However, I think I'd only been qualified probably about 6 months when I ended up being in charge at the weekends when
wow.
the staff nurses weren't on duty. So I actually was in charge of the ward then. And I had my insight into the management, and the ward went perfectly fine with me managing it. Never had any disasters, thankfully, but it was a lot harder to do both. It was a lot harder to be like caring for the children you've been allocated to and running the ward as well. Now we're trained to do that. We're trained to make that balance and make that shift and allocate work appropriately. So I don't think it's better now. I think it's different. I think the roles are very different. I think the MVQs, the carers, the HCAs or whatever they get called now do a lot more of the nursing work, which is sad. Nurses tend to do more procedures and clinics and things like that and assessments, whereas they don't necessarily get to do that hands-on, which I know for you, Lizzie, is like you want to do your wound care. You want to get in there and do it.
Yeah.
Delegating that to somebody else would probably be a bit hurtful. You'd be like, oh, I want to do that.
Yeah.
Hollie, the same. I think, you're like me. You want to be with a child and do the hands-on work and work with that child. So yeah, it's just different. I think it's different now rather than better.
I mean, there's a massive shortfall of nurses, isn't there? It's something like 55,000 nurses shortfall at the minute. Why do you think that is? Why? I don't.
Because they
Why
can't
do you
get
think
jobs
this?
when
You've been in nursing for a long time.
when I qualified, there was a job for you. They'd
Yeah.
taken you on, they'd trained you, and there was a job for you, and that was it. Nowadays, they train nurses, and there aren't necessarily the jobs for them because of cutbacks and all that stuff. NHS funding and things. And the carers, the HCAs, the MVQs are doing a lot more of the nursing care. You'll get even training for them that isn't necessarily as a registered nurse, but is almost like the enrolled nurse used to be. And they're probably doing everything short of giving medications. Some of them are doing medications as well. So I think it's really hard for newly qualified nurses to get jobs because those jobs are filled with the HCAs that have done the extra training. So the actual jobs aren't there for them. A lot of them are going into private practice because the jobs are there for them in there, but not in the NHS, which is sad. It's really sad.
I hear a lot. From
Sorry.
students that they're just about to qualify, but there's no jobs, and then all of a sudden there's lots and lots of jobs, and everybody's got a job, but there's that big worry, isn't there, just before they qualify,
Yeah.
that there isn't any jobs out there.
Yeah.
That's what I do.
Yeah, so you can get people going into nursing, but there's just what do you do with them at the end? That's a shame, isn't it? That there's nothing. I literally, there just used to be like a whole list of jobs at the end of my training, and you just get one of them. So yeah, it's sad times. I think it's hard for them, and I think the other thing is that the jobs aren't necessarily in a field that they might want to be in. So they might have been doing their training all these years thinking like me, I want to be a baby nurse, So my aim at the end was to work on that baby ward, and that's what happened. I got a job on the baby ward. Nowadays, you might be training to be like you, Lizzie, you like the wound care, you might want to work in skin or on a ward, that does all of that stuff. But if you've got HCA's already doing all of that wound care and stuff, that's just not there for you. And you might end up, I don't know, some ward that some subject that you don't want to, you're not really passionate about. And then that gets you demoralised.
Yeah.
You're not happy. You're not happy going to work. You don't think, well, who I'm going to work. You think another day at work. So I think that demoralises nurses and sends them off in different directions to go and do something else, which is sad.
I think it's difficult as well because potentially an issue that's kind of up and coming at the moment is that you might get a job, but it might not be that there are many other experienced staff. So what I hear often is that people aren't getting the support when they start in a role. So it's very much like, okay, here you are, this is your role, off you go. But what I think is really important actually is that, I mean, anybody who's new, you need the support, don't you? You can't just know everything instantly. You're not, you're a human being, you're not a machine.
Yeah.
So the issue, I think, is that a lot of experienced nurses are potentially retiring or going to other areas that are potentially less sort of physically demanding because they've got, they've got lived experience, they've got a bad back, they've got bad knees, whatever it might be, especially in wound care, it's always bad knees.
Yeah. Oh, yeah.
But then you're losing that lived experience and that knowledge that is traditionally passed down, isn't it? It's what we were saying about if you've got a student, you give them all the information that's in your head, and they then take that with them. And I think my passion for wound care came from a placement that I did where it was a community placement, and it was a really, really experienced community nurse who'd been in, she'd done all sorts of jobs in the community, but her wound care knowledge was so, it was just ingrained into her, and her knowledge of what different people needed and what she could try next. And that very sort of positive, like, well, we will heal it. We've just got to find the thing that will heal it. And without that, I don't know that would have been as strong in me as it is now, because she's handed that on to me. So if you go into a role and there isn't anybody who's got that sort of knowledge and experience, you're not going to become passionate about it because there's nobody to sort of build that enthusiasm, is there? So I think it's a challenge for lots of newly qualified nurses when they do get that job to kind of find a buddy that can kind of give them that knowledge that they can then pass on, because then it becomes the last thing you want if you don't feel confident is to then have to teach a student, for example. So that has an impact on the student placements as well, because they don't get the quality of learning. So it's kind of a bit of a snowball effect of sort of problems that crop up, and it kind of reduces the enthusiasm, I think, and reduces that passion potentially.
I think that brings us back to what you were just saying about online training, doesn't it? It brings us back to that, and that when you are face to face with a person or a group of people, that passion just exudes from you, doesn't it? Because you actually are in a group of people that are commenting and talking to you and giving you their experiences as well. I think that's the difference between online training and face to face training for us as nurses. We're used to sharing stuff face to face, aren't we? And actually showing somebody, demonstrating a skill to somebody. So I think that is the difference between, the whole tick box training thing online that people do, and the actually having a nurse in the room with them, actually showing them and saying, this is how you do it. This is what might go wrong. This is not how to do it. This is how to do it. Don't do it that way because this will happen, and do it that way and then that will work. I think that is the whole difference for us as nurse trainers. It really shows why we're in the job, because we all love being in a room with people training them, don't we?
Absolutely.
And I think, for Hollie and I, obviously we've worked together a lot when she first joined Momentum People, and she was in a room with me training, and we had lots of chats, didn't we, Hollie, about how I train, and what different things about training, different aspects. I mean, that for me, it's like having a student nurse. Yay! I used to love having a student nurse as well, but it's so nice to have a person with you that you're showing that to, and that never changes as nurses, I don't think, does it? I think we're always wanting to impart our knowledge.
And because we were together, and Lizzie, I also spent time with you, didn't I? I felt the passion. I felt when you were teaching, and I felt what you were giving to the room as well, which was really lovely. So that helped me in my training as well, because obviously I haven't training for that long with Momentum People, but just seeing your passion and how you do it. And I've took loads and loads of notes. I mean, you saw me writing all my notes when I was with you guys on how you're delivering your training and what it means as well, which was really, really invaluable.
Yeah, definitely. And I think that's what we've probably all wanted to give to student nurses over the years, haven't we? I'd like to think there are some student nurses out there that think back to each of us and go, oh, I remember that because so-and-so showed me that, so-and-so trained me.
And hopefully they've gone into the profession with a full heart, ready to get their teeth into whatever it is they've chosen to get into, whether it be, whether they've followed you, Lizzie, and gone into wound care, or, if they've gone into complex needs like us, Liz, or, whatever they've chosen to do. I mean, I've always had, when I've done training in the past, I've always had really, really positive feedback from students, because I love having students. And I think that, they can feel that when they're with me and I'm, really positive about things. I think they feel it, don't they? And then they go away feeling like, actually, that's the sort of nurse that I want to be. Well, that's how they go away anyway.
And I think... Sorry, Lizzie, go on. Liz. I was just thinking, hopefully that the nurses that are out there are still doing that with their student nurses. I know it's difficult at times, with the time constraints and all that you have to do in a shift and whatever, but I hope there are still nurses on the ward that are doing what we three have clearly all done in our practice when we were actually nursing rather than training. I hope they are still doing that, because I love that part of it. I was like you, Holly. I loved having a student nurse and like showing them all the different aspects of the, of the wherever we were working. I really enjoyed that. It was really good. You're shaping the future nurses, aren't you? Hopefully, adding that little bit of something to them.
Actually, going back to what we were talking about the sort of different division of the roles, I think it's quite interesting that they've brought the nursing associate role back, because I think actually it's recognising that the lived experience and the kind of incremental learning that you get through doing a job, that builds a nurse almost, doesn't it? You can write a lot of theoretical stuff, but actually it's the doing it in practice, because it's not always going to go how it said it was going to go in the textbook. In fact, 99 times out of 100, probably it's not going to be, you get to doing a catheter with somebody and the anatomy is not how they told you it was going to be in the A&P manual, but you only get that confidence and that level of experience by doing these things. And I know I've got quite a few colleagues who started as HCAs, became nursing associates, and have now done their nursing degree. And the level of confidence that they've got in their own practice and the breadth of knowledge that they've gained is amazing. And like, really hats off to them, because they've worked as well as doing the degree. They've not just done the degree. But I think that lived experience and that support from having a designated mentor for all that period of time as well has been really beneficial to them, because they've had that input, and they've had that input on a sort of clinical level, but also on a theoretical. They know their theoretical stuff, but they have actually lived it and put it into practice as well.
Yeah, absolutely. I mean, I've been momentum people for nearly 4 years now, but I was associate before then, so it's more like 7 years. It's quite a long time. And things have changed so much for us, I think, as trainers. I mean, I was the only nurse trainer for quite some time, and obviously TJ was doing training as well. And we have moved the training on so much in those years, to the fact that we now have a team of passionate nurses that are delivering really high standard training in the workplace to groups of people. And I feel like we're not training nurses, but I do feel like we are supporting people to do things that they never would have dreamed of doing before. In the team I worked in previously, they were right to the point of looking after a ventilated child in his own home. They're not registered nurses. They're carers that come from all different backgrounds and environments that actually have been trained to look after somebody who's on a ventilator at home. How amazing is that?
Yeah.
And when I wanted to be a baby nurse, I never imagined that I'd be training people to look after ventilated kids in the community.
Yeah.
How things have moved on, and what we bring to momentum people, I think, is a wealth of experience and knowledge between us, because we have all come from different backgrounds, and I think that makes us really a really experienced team.
Yeah.
A really experienced team, because we've literally all got something different. So that's why our training is so high quality, because we all bring something different.
We're passionate about different things. You've got your little areas of expertise that you absolutely love going out and training, and you see it when you go out and train it. You can see it. And Lizzie, the same. You've got your own little areas, and I read your wound care presentation while I was eating my lunch. Actually, I regretted that.
Bad luck on that one.
Not sure about eating lunch while you're looking at wounds.
Yeah, so that was nice. But as nurses, it doesn't really affect us as much as it would anybody else, does it? I just carried on eating my lunch.
But no, I think our whole ethos as a company is so positive, and we're all so passionate about the training being the best training we could possibly deliver. And that's not about being almost big-headed, if you like. It's actually a passion that all of the trainers actually hold that passion. And take it forward into training. And if you ever go somewhere where one of the others of us has been, you'll always get like really nice feedback from people about, Hollie was here and she did such and such, or Lizzie was really good, or TJ was really good. It's nice that it's across the board. There's not one of us that doesn't have that passion, and it shows, and I love it.
Yeah.
And I think that's really important in the organisation as well, isn't it? In terms of, to want to be a nurse, I think having a team of people that's positive, that's kind of celebrating your success, like celebrating your own success, but celebrating the success of something as a whole, and looking at how it's not about finding the fault with things. It's okay, how can we improve? Like if we've had some
Yeah.
feedback on something that somebody's picked up that they'd like
Yeah.
it done differently, okay, is that something that we've seen elsewhere? Is that like a
Yeah.
specific learning preference for that person?
Yeah.
And sort of it's a culture of positive feedback and a culture of sort of moving things forward rather than focusing on any negative things. And I think that makes a huge difference. I know
It does.
certainly it's difficult, isn't it? Because obviously you have to sort out the mistakes and things as well. But I think sometimes I've worked in organisations where the culture isn't as positive, and that
Yeah.
definitely has an impact on my sense of whether I'm doing a good job or not, actually.
Yeah.
And that can sort of, coming a bit back to why we've got so many vacancies, maybe it makes you
Yeah.
feel less motivated and less sort of, you get a bit sort of, oh well, if all I'm going to get is, you know, moaning about things, then what's the point, sort of thing. And I think actually having a positive environment, positive feedback opportunities is really key to
Yeah.
sort of driving that passion and driving people to keep wanting to be motivated and do a really thorough job of everything.
100%. Yeah, definitely.
Yeah.
Because when you're
Because
tired
we've
and
had
you're
conversations
overworked,
about that, haven't we, Liz?
We have had a lot of conversations
In
about
our things. We've had quite a
yeah.
few conversations about that because I've come from quite a negative environment where I've felt very sort of downtrodden, and coming into Momentum, it's been a real transition for me with all the
Yeah.
positivity, and I'm kind of half expecting someone to pull me up on something, and it's just not happening.
No.
Yeah.
No. It's
I'm kind
I
of just
think that
waiting for it.
that's not going to be happening. It's not going to be happening. In Momentum People, we, you know, if there is an issue to discuss, it is discussed in a positive way and how
Yeah.
to move forward. It's not a blame culture, and there can be that out there, I feel, for a lot of nurses. And like you say, like when we have student nurses, we're praising them all the time, aren't we? Going, oh, well done, you did a really good job of that. And,
Yeah.
you know, and constantly making them feel positive about the placement that they're actually in with us, which is why they probably like us as mentors, because we are very positive. I mean,
Yeah.
and I can't say that I've never had any positive feedback in my nursing career. I have in, you know, just not maybe as much as I think I might deserve or whatever, but I have had some really kind, positive feedback over the years, but I've also had some very negative, demoralizing, unnecessary feedback as well. So I think it's about people balancing that feedback. It should be constructive. If you're going to give somebody feedback if they've done something wrong as a nurse, I think when these junior nurses are out on the ward, they're still learning. It's like driving a car. You do your lessons, you do your test, and you pass, but actually you don't start learning until you get out there on the road. You know, that's when you start learning through experience, don't you? Experience of driving. And it's exactly the same in nursing, you know, and you need somebody to keep you up and go, actually, you know, you did a really good job today, but maybe tomorrow we could do this, this, and this, you know, and that's what I think nurses need at the moment. The nurses out there that are leaving, they're leaving because they're not getting constructive feedback or positive affirmations for what they're actually doing. And I do feel that that's some of it. That's why nurses are leaving. I think they just don't have that positivity that you guys have felt since you've come to Momentum People, and I've felt since I've been with Momentum People.
It links back to the training as well, doesn't it? In terms of, I think often I think CPD for nurses becomes sort of like, oh, it's got to be done because we've got to tick off our 35 hours in order to get through our revalidation, and we've got to have our mandatory training up to date. Otherwise, we get a slap on the wrist for not having done our mandatory training, and it sort of becomes a bit of a rote learning exercise. Let's flick through some videos. Let's do the multiple choice quiz at the end and hope that some of it sticks until the next time we have to do it the following year. And I think actually that doesn't make you feel like an individual that's valued within an organisation. That makes you feel like you're in the sort of sausage factory of having to be like everyone else almost. And I think the biggest strength of nursing is that actually not everybody has the same approach. Like, you know, I've seen nurses who are incredible, but they don't do things how I would do them, but they still do an amazing job. And that's fine. You know, actually, as long as they're practicing safely, they don't have to be a carbon copy of everybody else. They can bring their own unique,
Absolutely,
you know, approach to things, providing they're doing things safely and within the, you know, policies and procedures and guidelines and what have you. But, you know, their methods of communication and things might be completely different, and that's okay. But I think that gets a bit lost sometimes. We sort of feel like we have to fall into that line of doing the same as everybody else. And that's a bit, you don't feel like yourself in your job. And I think that's really important to nurses, is that you bring yourself to work, don't you? You're not a different person at home as you are at work. You need to be the same person.
You do. And I think a lot of I don't think mandatory training or even getting CPD done when you work within the NHS is easy, because you're on shifts all the time, you're busy, you're tired, it's done in a day off or something like that, or it's a very quick train to tick that box. I mean, I did my revalidation this year and mine was done a month before it was due to be done, because Momentum people gave me so much CPD. I literally was, I'm like, which shall I put in? I've got so much choice. I've never had that much choice of courses that I've done or training that I've done that's been participatory as well. So for me, I think that's been, even though I'm like more at the end of my career, it's been so valuable. I feel like I've actually learned things that I need to learn, rather than it being like, oh, well, you need to go and do this every year, and it's the same presentation every year, and you know the video, but you could almost like speak the video because you've heard it so many times. And the basic life support, you've already done that, and it's all very much tick box. And I part of the reason why when I was offered this job I left was because I wanted to train in my own way, the way that I think is valuable, the way that I think embeds in people's minds, and that opportunity wasn't there in my previous job in the NHS. It just wasn't there because of time constraints, and it's not their fault that that's how it is. It's just that there just wasn't there wasn't the time for me to actually do that, to actually deliver that training the way I wanted to do it in a really positive, high standard. So I think that does make a difference. CPD for me, like I say, I've probably got enough for the next 10 years, but it's good. I mean, you could say like we did first aid training, didn't we, a couple of weeks ago, and that ticks a lot of boxes, doesn't it? If you put that into your revalidation, you're almost there. So I think moving toward a private company to deliver training for some nurses would be a good move. I think if that's your passion, is training other people, you need to be able to do it in the right environment, don't you?
Yeah.
So if you could give one piece of advice then to anyone thinking of becoming a nurse or coming into healthcare now, what would that be? What do you think it would be?
I think you should go first.
I think I should go first,
Hollie.
Okay. So I think I would say find your niche, find what makes you happy, find where your passion is, and develop that. And that's what I did. I found my specialist area, my children with complex needs. As Liz knows, a trachea and long-term ventilation is my cup of tea. That's what I really enjoy doing, and I enjoy teaching it. I want my knowledge to be carried on to the next generation, the next people. When I found what I loved, I did all the research that I could. I went down to London to the NMC library and got all my books out and did all my research before so much online, but did all that. So that would be my advice: find the thing that you're passionate about and run with it.
Good advice.
100%. What do you think, Lizzie?
I would say your niche is really important. I absolutely agree with that, but I also think find a team that sort of fits, that you fit into, and that they don't all have to have the same opinion as you. You can have differences in opinion, can't you? That's absolutely fine. But a team that respects you and your experience and what you bring to the service, I think, is kind of my biggest thing. Is that what I enjoy being about part of this team is that I feel like everybody's knowledge and experience is really highly respected, and that everyone's got something to bring to the table. And I think if you can work in an organisation that, even if it's just a really small team, that treats you in that way, and that you don't have to all be best buddies, but that at work you have a really good working solid relationship, that makes every day a pleasure. Really, it doesn't feel like going to work. It feels like being part of something.
Absolutely.
Yeah, definitely.
I think for me, it's going to it with your eyes open. Don't see nurses as through your rose tinted specs. It's hard. It is a hard profession to enter into, but it's rewarding in so many ways. Have a plan have a specific career path that you think you want to follow. That can be changed later, you know, when you come across things that you fall in love with, which we've all said that we have. But I think if you have a plan and you have structured plan and you know where you want to go in your career, you have that focus, everything else will just fall into place. And like you've said, you find the right team, find the right place for you. When you find it, you'll so know it.
Yeah,
You'll so know it.
definitely.
Yeah,
And
definitely.
it might not be a place you always stay. It might be a place that's for now and it's
Yeah.
brilliant and you love it. And then you might think, "Oh, actually, I really want to do that. I really want to do the other." But keep your pathway clear and make, you know, for changes, and just have a focus. What do I want to do? What do I want to become? When you say I want to become a nurse, what do you mean by that?
Yeah.
What do you want to, yeah, think about that, write it down, think about it a lot, you know, explore the different avenues in nursing. There are so many that
Yeah.
you can go. I've done so many different roles. I was a pain specialist nurse for 12 years. Absolutely loved that job. Absolutely loved it. It was my passion at the time. At the same time, I was caring for complex needs kids in their own homes. So it was a split role. So actually, I got the best of both worlds there. I actually had a role where, you know, two roles that I could actually be passionate about and do. And that's just how it fell for me. And this, I ended up now training all that knowledge and experience I got from all those roles. So yeah, if you're going to thinking of coming to nursing, make sure you know exactly where it is you want to be at the end. That's what I would say.
I think that's what's so brilliant
Pretty-
about nursing in some respects, though, isn't it? Is that you're not just a nurse. You can be any type of nurse, from,
Yep.
you know, neonatal, babies, children, adults with complex needs, cardiology, neurology,
Yeah,
old age
yeah.
care, whatever it might be. And then even
World's
within
your
those
limit, the
areas,
world's your oyster.
you
Yes.
can really dig in deep, can't you? You meet
Yeah.
people throughout your career and you think, wow, they know everything there is to know about one very specific condition. And that's their thing. That's, you know, they've
Yeah.
gone down that rabbit hole and they're firmly embedded
Yeah.
in their rabbit hole.
Yeah.
They're not coming
Yeah,
out for love nor
Absolutely.
money. Some
think-
people just, you know, jump around all over the place. I've worked with people who are in orthopedics via cardiology and vascular surgery or whatever
Yeah.
it might be. But yeah, there is a
Yeah.
path out there. You've just got to find your one.
Yeah. I think that's us done.
On that positive note, it's been absolutely lovely to have this conversation with you girls.
Thank you.
You
On
too.
International Nurses Month.
Yay.
We'll have the whole month, shall we?
Yeah.
Yeah,
Let's
why
do the whole
not?
month. We could probably go on talking for days.
Yeah,
Oh, we could, couldn't
definitely.
we? But we'll perhaps stop here. Thanks, everybody.
Thank you.
Thanks, guys.
And that right there is why these three are so brilliant at what they do. I hope you loved listening to that as much as I did, because even hearing it back, it just fills you up a bit, doesn't it? Hollie, Liz and Lizzie, thank you. 45 years, 9 years and 16 years. Every single one of you still talking about nursing like you chose it all over again, fresh. That is something really special. If this episode has got you thinking about your team, your passion, or maybe about the kind of training culture you want to be part of, we'd love to hear from you. And if you've got a colleague or manager who needs to hear this one, send it their way. We'll be back with more Momentum Matters very soon. Until then, take care of yourselves and take care of the people that you're working with too. Bye for now.